It's a pleasure to have you here. The details now. Pregnant women and other patients who want to access the University of Cape Coast Hospital have been left frustrated. The Federation of University Senior Staff Association at the University of Cape Coast have withdrawn essential and critical services, which include ones given at the hospital and schools. Over 6,000 members of the association in 10 public universities laid down their tools on May 19 in protest over poor working conditions and the failure of government to pay accrued pensions. Now, despite government's assurance of resolving the grievances, the association insists it will continue to strike. Richard Kodonyako went around the University of Cape Coast campus and reports apart from the hospital, most of the classrooms at the university's basic school are without teachers, and students have taken over the teaching of their peers.
On the campuses of the University of Cape Coast, the strike by the Federation of the University Senior Staff Association was having a huge impact as members of the federation who work at the university hospital have withdrawn their services. Pregnant women who had come to be seen by hospital officials were left unattended too.
As a pregnant woman, you know that sometimes there will be complications. Even if there is none, you have to come so that you see that your baby is healthy or not. But here we are. I came here around 5. Then nothing is showing. I'm still sitting here.
And they are telling us that the antenatal books are finished because they have to go and take it from stores. And the stores people are also on strike. So because of that, no one can take care of her. Even the junior staff people cannot take care of her because there is no book for them to take the records inside. So we are just sitting here hoping that someone can come here to help us. It's very difficult. Some of us have to go to work too. And we've left work coming to take care of ourselves here and only to be told because they are on strike, nothing can be done to us.
The situation was no different at the University Basic School. The teachers who belonged to the Federation were not in class when the task force went round whipping their members into line. The school pupils expressed their worry and called for something urgent to be done.
The teachers are gone, and as we are in the class, we are not doing anything. All we are doing is fooling, and one day we will not get any job to do.
The strike has affected our teachers, and some of them are not even coming to school. So I will appeal to the government that they should try and stop the strike and pay them with their money so that we can get learning effective.
Director of the University Health Services, Dr. Evans Ekenam, says his outfit was doing all it can to contain the situation, but pleaded with the authorities to see to the end of the challenge.
The manpower that we need, those experienced hands, we don't have them on the ground, and it's really a problem. We've had to refer many of our cases to the teaching hospital, and that is not the best. That is not the best. So we are really feeling the impact on the ground. And but we still continue to do our work because we are health professionals. We are like military people. No matter what it is, we have to keep protecting our people, and that's the job we are still doing on the ground.
Chairman of the University of Cape Coast Federation of the University Senior Staff Association of Ghana, Sandy Kumisinatra, says they won't relent until their demands are met.
I'm highly impressed looking at the compliance level of our members. Almost all of them are at home, and we encourage them to continue to do that for us, as we also do our best as leaders to make sure that our demands are being pressed home. Unfortunately, no, that is not what we wish for the people. We wish that the academic calendar will not be disrupted, that people can go about their normal duties without any disruption. But unfortunately, where we are, we have no better option than to rope them in to strike, to press on our demands. The work of the task force has not been ended. It is now that we have even re-engineered them to go down to the grounds and do the work and do it effectively to make sure that none of our members comes to work so that the effects that we all anticipate will be achieved.
As the Federation has withdrawn the critical and essential services, the strike is becoming extremely biting. Patients and parents are calling on government to act to avert any unfortunate occurrences. Reporting for JoyNews, Richard Kodonyako, Cape Coast.
So thankfully we have Richard Kodonyako on the line, and Richard joins us via Zoom. Hello Richard, paint a picture to us of what the situation is like this morning. Hi, if you can unmute so we hear what you're saying.
Okay, so this morning the situation is not different from yesterday, how the situation was. Patients that went to the the University of Cape Coast Hospital are stranded as of now because there are no workers to serve them. In fact, it's left with some slim staff there, national service persons, and other people that the university health services have fallen on to come and fill the vacuum that has been created as a result of the absence of the Senior Staff Association of Ghana. So that is the situation at the University of Cape Coast Hospital. If you go to the University Basic School, the situation is terrible. And so there is currently a management meeting to decide whether the school pupils there are supposed to go home because they will go to school and there would be no teachers in the classroom. The task force that has been formed by the Senior Staff Association of Ghana, they are moving around the offices, the schools, the hospitals to drive away some of their members who have decided to go to work. And so that is what the task force has done, and they are still doing. Yesterday, they decided to embark on that operation, and this morning, they are moving from one university office to the other, to the hospitals, and to sack members that would not stay home, that would not heed to their advice. And so that is what currently is happening.
So tell us what the alternatives are for these pregnant women and patients who try to access healthcare at the university's hospital.
So some of them, because they have made the University of Cape Coast Hospital where they go to for their services, they started the antenatal care. And so there are specific medical officers there who attend to them. So now they do not know what to do other than to switch to other places. Then they would have to start all over because they would want to go and secure cards. But members within the University of Cape Coast community, the University of Cape Coast Hospital is where they go to for medical attention. And so going to other facilities is a clear problem. It's a huge problem for them. But for the University Basic School, and that is where the situation is because parents have come to drop their kids. They expect that the teachers that belong to the Senior Staff Association would teach them. And they go there, and it is peer teaching that is currently ongoing because the teachers who, came to school have been driven away by the task force that has been formed by them. And so the management is currently in a meeting deciding whether there should be a closure of the basic schools there so that the students will not come to school and then be left stranded in the classroom.
All right, Richard, if I get you right, these teachers are at the schools but are not teaching, right?
Some have come.
So who's taking responsibility for the kids who've been brought in by their parents? Is the situation that they've been left on their own?
So there are a few of them who do not belong to the Senior Staff Association. They belong to other associations like the GAWA, so the University Administrators Association. And so these are the people that are currently there, but they are not enough to carry out what all of them would have done in the classroom. And so it's left with some slim staff who would have to take care of all of them because the Senior Staff Association, they represent one of the biggest numbers as far as the university setting is concerned.
All right, so at least there's some adult supervision. That's what I wanted to know. All right, the teachers who belong to FUSAG, are they directly employed by the university or they are under the Ghana Education Service?
They are paid by the university, so they've been employed by the university. It's a complex situation. They fall under the GS, but they also fall under the university service. So it's the university that pays them. They get their promotions and everything through the university system. So it is the university that caters for their needs and their salaries as well.
And Richard, finally, as you go, we know that the university is trying hard to deal with the situation. But have you been able to get a word or two, at least, from its management or PRO?
So yesterday, when we interacted with the Director of Health Services at the University of Cape Coast, he intimated to us that he is going to speak with the Vice Chancellor and management would be meeting over this matter to decide what the appropriate remedies should be. And so today we reckon that the university management should be meeting on this case because it is becoming extremely biting for not only the university hospital and then the basic school, but how people, the students of the university, those who are currently undertaking sandwich at the university, how they even access simple services at the university. So it appears it is affecting a whole lot as far as the university setting is concerned.
All right. Thank you very much, Richard Kodonyako, joining us from the Central Region capital, Cape Coast, painting that picture to us of the situation at the University of Cape Coast.